Professor Pekosz, thank you for joining us. If you look at COVID cases, but also the number of hospitalizations in the U.S., it's very different state by state. Why is it so?
Yeah, so this is a reflection of the epidemic and how it varies based on the geographic region within the United States that you're in. And it also is now being affected by the different states and their rollout of pulling back on public health interventions. So you're seeing that combination of how many cases were going on within a state and how those public health interventions are being loosened that are leading to these different numbers of cases.
Houston is weighing a new lockdown. What have we learned? If you look at all the data from all the various states, what is the right way of doing an opening of an economy or easing of the lockdown, and what is the dangerous way of doing it?
Well, I think the most critical thing when loosening these public health interventions is to make sure that testing and contact tracing capabilities are at a very high level. Because you don't just want to release the public health interventions, you also want to have in place ways to identify and track the cases that are going to occur. But if you have the capability to do the testing and the tracing, you can identify those cases, quarantine the individuals that are ill as well as their contacts, and then keep the number of cases low. My worry is that in some of these states that have eased their public health interventions, those testing and contact tracing capabilities are not at the right level to be able to now keep the cases at a low level.
Andrew, do we have an idea, if you're going to make an informed decision on how to ease a lockdown, you need data. Do we have an idea about how many people or what percentage of the population in each state has actually had COVID-19?
So some of those tests are certainly coming up. What's really important is to know that your testing capability is relatively high and that your testing positive numbers are at a relatively low level, meaning around 5% or so. If you have reached those capabilities, then there's a realistic chance of your state being able to respond with the testing and tracing capabilities to limit the spread of the virus. So if you ease those public health interventions when there's still a large numbers of cases around, the rebound in terms of numbers of cases is going to be really fast. So you want to get the cases down low and then have the capability to keep them low through the testing and contact tracing.
What can you tell us about the capacity for hospital beds in intensive care units? You know, are we reaching the limits in certain states, or actually is there room to kind of test this gradual lockdown?
Yeah, and that's one of the most important questions that has to be followed on a state-by-state and perhaps even a city-by-city basis. The real worry is that you exceed capacity to deal with the severely ill, and that's based on hospitalizations as well as intensive care unit bed capacities. We're seeing those levels rise in a number of states. Other states, and I'll call out the state I'm in now, Maryland, hasn't seen those surges as they've tried to relieve the public health interventions. So again, it really comes down to each state really assessing the number of cases and their ability to follow those cases and making informed decisions based on that, whether they can, that drives the rate in which they pull back their public health interventions.
Andrew, what was the approach in the U.S., or how was it different to Europe and Southeast Asia?
Well, I think in other parts of the country, in Southeast Asia, for instance, you saw a much more intense, rapid movement into testing and contact tracing at the early stages of the pandemic. What you're seeing in Europe, their method of control was once the virus got there, they really got their testing up to speed, put in public health interventions, lowered those cases to a significantly low level, and then were able to open up the economy when their cases got very, very low. In many parts of the U.S., our case numbers really didn't get that low before we started to roll back our public health interventions. It doesn't make it impossible to control the case numbers, but it makes it incredibly difficult because you need much, much more resources to do the testing and contact tracing. I know it sounds like a broken record, but it really comes down to testing and contact tracing as a means of controlling the bounce backs that we're seeing in these states as public health interventions roll back.